Welcome to your 10-phase unfolding case study. In today's scenario, you will follow Mr. Clarence, a 75-year-old white male who's experiencing a medical emergency at his assisted living facility. As his case unfolds, you will have the opportunity to gather, assess, and determine what medical mystery ails our client. And remember, things aren't always what they seem. Meet Clarence, a senior citizen, a decorated war veteran, and a longtime resident of Stony Oak Assisted Living. He is a widower, has 2 adult children, had a full knee replacement over 7 years ago. He is a chronic smoker with a history of diabetes, hypertension, hyperlipidemia, PTSD, and COPD. During a chess game with his friend, Mr. Clarence experienced a COPD exacerbation, which triggered a PTSD flashback. It caused him to go into a panic, believing that they were under attack. In his distress, he attempted to take cover under the table. He fell and hit his head, losing consciousness. His friend promptly called for assistance.
EMS arrives to find Clarence unconscious on the floor. They do a rapid assessment, noting laceration above the left eyebrow, shallow breathing, elevated heart rate, weak pulses, low oxygen saturation, intercostal retractions, and a fractured left femur. Based on their findings, what interventions do you anticipate? If you answer the following, you are correct.
Clarence arrives at the ED and is promptly assessed using the ABCDE approach. Vital signs are checked, with notable changes including an increased respiratory rate and improved oxygen saturation. A neurological exam reveals continued confusion and agitation, indicating underlying PTSD. Concerned about a head injury, doctors order a CT scan. Nurses establish for access and administer fluids. Comprehensive lab tests are ordered, including CBC, BMP, coagulation studies, and ADG analysis. X-rays reveal a femoral shaft fracture. Pain management includes morphine, while respiratory support consists of albuterol/ipratropium bromide and oxygen. Pharmacists reconcile Clarence's medications, which include rosuvastatin, acarbose, losartan, Advair, iron, vitamin B12, and folic acid. More medication decisions await pending lab results.
So the diagnosis reviews Clarence's admission reports, his vital signs and diagnostic results. Everything seems within range. An individual system assessment confirms COPD exacerbation with respiratory distress and wheezes. COPD exacerbation? So I guess Clarence came in here with a barrel chest, maybe? 1-to-1 anterior posterior. Oh, he also came in with maybe some sternal retractions. Neurochecks indicates intact brainstem function. Okay. The only other concerns are mild abdominal distension with hypoactive bowel sounds and the left femoral fracture. Hypoactive bowel. Okay. So his urine test reveals a UTI. Okay, that makes sense now though. Maybe that's why he's been confused and agitated, right? However, the doctors feel it's not significant enough for them to delay his surgery for his femoral fracture. Clara's gonna get that surgery.
I told you so.
After undergoing successful intramedullary nailing for the left femoral shaft fracture, Clarence is in post-operative care in the ICU. His medical team discusses his case, noting stable vital signs, but addressing his confusion, agitation, and elevated lab values indicating renal, diabetic, and UTI issues. They plan treatment with Rosefin for the UTI and further investigations including a renal ultrasound and hepatic panel due to abnormal liver function test and abdominal ultrasound findings. The bacterial culture confirms E. coli UTI. The team emphasizes a multidisciplinary approach and ongoing communication with Clarence and his family for optimal care. Knowledge check. What type of antibiotic is Rocephin? You should know this. This is what we're currently studying. If you answered A, cephalosporin, you are correct.
After a challenging recovery period, Clarence has made progress with the help of physical therapy and support from his daughter and caretakers. He's now able to live independently with a cane, but shows signs of emotional distress and physical decline. His daughter notices Clarence's increasing withdrawal and anxiety, prompting a visit to his primary physician. Concerns about tremors, rigidity, and other symptoms lead to a diagnosis of Parkinson's disease by a neurologist. Treatment with levodopa/carbidopa, Sinemet, is initiated, with adjustments to other medications to prevent adverse interactions. Blood work reveals generally normal kidney, liver, and lipid panel results, indicating a stable physiological state. Clarence and his daughter receive education on the medications, expected effects, and potential side effects, as well as dietary and lifestyle adjustments.
We all know that levodopa is so effective for Parkinson's disease. Like Mr. Levo is so effective that after a long period of taking it and our patient doesn't show an improvement, then we might have to start questioning that initial diagnosis of Parkinson's disease. So here's our man, Mr. Clarence. He's been taking this medication and he is not showing any improvement with his levodopa-carbidopa therapy. So now the healthcare team is perplexed. They're going to run more tests to rule out other possible diagnoses. They're worried. They keep asking, Mr. Clarence, why are you not improving? What is going on with you? Why isn't anything changing? However, his lab results are inconclusive and they are unable to determine what is wrong with Mr. Clarence.
Clarence's daughter schedules an appointment with his primary care provider. However, his visit is not what they hoped for. In this phase, we will learn the importance of holistic patient care. Despite Clarence's worsening symptoms, his primary care provider seems dismissive during their visit, attributing his complaints to age and previous PTSD diagnosis. The doctor suggests Clarence's symptoms might be psychosomatic or related to old age, overlooking potential underlying medical conditions. Despite his daughter's concerns, the doctor doesn't order any labs, relying on recent results from the specialist, and refers Clarence to a psychiatrist. This dismissal leaves Clarence feeling hopeless and his daughter frustrated. Not very effective patient care, huh?
I must agree with Nurse Rebecca. Part of providing good patient care is being able to build a rapport with your patients. Remember, it is our job to listen to our patients non-judgmentally and appease their concerns in the process. Well, with the ongoing mystery of Clarence's condition, his daughter, who just happens to be a fan of medical TV shows, presents an interesting but unconventional diagnosis. And although Professor Perez says, think horse, not zebra, well, sometimes it is a zebra. After the daughter shares her thoughts based on an episode of House, Nurse Chad, that's me, decides to look further into the diagnosis suggested. It reminded her about a case study she read a while back concerning metallosis, or metal poisoning. She contacts the orthopedic surgeon who performed Clarence's knee replacement, learning of potential cobalt toxicity. Lab test results confirm elevated cobalt levels, consistent with cobalt toxicity from the knee replacement. Armed with this discovery, Chad shares her findings with the medical team, emphasizing the connection between cobalt poisoning and Clarence's symptoms. A surgical consult is scheduled and hemodialysis planned to lower cobalt levels. With Chad's persistence, there's closer to addressing the root cause of Clarence's health issues.
problematic knee implant. Post-surgery, Clarence experiences gradual improvement in his symptoms, including reduced pain, improved cognitive function, and enhanced mobility. Months later, at his final checkup, Clarence shows significant progress across various health parameters. His cognitive function, cardiovascular health, respiratory function, gastrointestinal function, and musculoskeletal health have all improved greatly. Clarence expresses gratitude for the dedication of his healthcare team, and his daughter is relieved to see her father's health restored. With Clarence's symptoms resolved and his quality of life restored, he looks forward to enjoying his retirement years with renewed vitality and optimism.